Hi, and welcome to the California Diabetes and Pregnancy Program Sweet Success Program Updates. I represent the Resource and Training Center on behalf of our whole team there. My name is Tracy Esquivel, and let's get started. Here's our disclaimer. We only have 3 objectives for this presentation, and first we want to recognize that CDAPP Sweet Success and this program's funding is ending this Thursday, June 30th, 2022. Although the program is not being funded, we still want to take this opportunity to share all that we've accomplished in the last fiscal year, as well as the annual survey results from calendar year 2021. There's no easy way of sharing this, but the California Department of Public Health Maternal, Child, and Adolescent Health Division put out a letter announcing the removal of funding for CDAPP Sweet Success. Here is what that letter looks like. I have also provided a copy in the email blast of this program update. It is on the homepage of our website, and it goes into detail about the removal of funds as well as potential brainstorming for the future in terms of this program. What does this mean? It means that affiliates must look to MCAH for all or any future communications about this program, and there will not be any new trainings, materials, or forms due for this coming year. The letter does state that the CDAPP materials will be posted on the CDPH website, and so I've included the CDAPP Sweet Success landing page on the CDPH website here in the second link, or in the 4th bullet down, as I'm assuming that's where they're going to be placing it. The CDAPPSweetSuccess.org website will no longer be available after June 30th. All questions, comments, thoughts, concerns should be directed to Lisa Schalk, and I've added her email here. The letter specifically states that as well. Now I'd like to transition to highlighting where we ended and how far we've come by sharing the annual affiliate survey results, as well as program accomplishments. So let's dive into that. In total, we have 193 active affiliate sites throughout the state of California, and you can see the geolocations mapped in purple on the left. We have 38 counties represented out of California's 58 total counties. The deeper and darker the purple, the more affiliate sites. So Kern, Los Angeles, and San Diego County have 15 plus affiliate sites. Our reach is pretty good. When we asked on the annual affiliate survey, if you have more than 5 staff persons who see patients, 31% of you said yes, and 69% said no. Comparatively to the last year, so this is 2021 data, so to 2020 data, that yes was only at 24%. So that means our individual affiliate providers have increased, and it ranges quite a bit. It can be, 1 to 2 staff persons at an affiliate site who are seeing patients who have diabetes during pregnancy, but it can also be 24 staff members. So a huge team that represent multidisciplinary health and our model of care that we have just got behind since the beginning. When we asked, what does your affiliate site most identify as being a part of, 50% of our affiliates represent, or almost 50%, a healthcare system such as the Sharps, Dignity, Sutter Health, etc. 19% represent freestanding clinic or a private medical office, followed by 16% at the private hospital, The 8% as other was mostly listed as a community or outpatient hospital or other clinic. 5% is county hospital, and 2% is a university system. In regards to the background of staff reported, 44% represent our RDs, our RDNs. 37% are RNs or NPs. The other 6% was a variety of backgrounds, from LVN, psychologists, those with an MBA or who have a PA or a PA, health and wellness coaches, the list goes on. The remaining 8% are the health educators, social workers, certified nurse midwife, and pharmacists. I just want to point out that to be an active affiliate, so every site has a physician who is a medical director that oversees the program. So these physicians, when I put 5% are MD or DO, that's in addition to that one medical director. So that number is actually a little bit more, but this isn't a specific portion of the annual affiliate survey that asks for additional staff. At the end of the annual affiliate survey, we asked, is your organization also a National Diabetes Prevention Program registered site? Most of you said no at 77%. And we actually put out a series of 5 different training modules regarding billing, coding, and we go into the national DPP as a potential reimbursement stream in depth. So if you're interested in that, I would highly, highly recommend that 5 training module series, as we do talk about the DPP quite a bit. When we ask, do you refer postpartum women who have had gestational diabetes to the diabetes prevention program? 53% actually do refer. They're just at different levels and capacities, and 47% said that they never refer. Do you refer postpartum women with overt diabetes to the Diabetes Self-Management Education and Support Program, DSMES program? 72% of affiliates do refer postpartum women with overt diabetes to DSMES. 28% said that they never do. And again, more information on DSMES and DPP are on those recent training modules for potential reimbursement streams for your affiliate site. And I highly recommend you look at that. What types of insurances does your affiliate site accept? The parameters for this question were to check all that applied, therefore the percentages far exceed 100 if you add them all together. But it does go to show that many insurance types are taken. This was to inform our billing and coding training module series. This was the background of why we asked this question. Does your affiliate site accept outside referrals? 64% said yes, and 36% said no. If the CDAPP 266 patient educational resources were translated, what languages would most be utilized by your patient population? An overwhelming majority checked Spanish. The parameters of this question were to only pick 3 of the most that you use or would be utilized or the greatest need. So Spanish takes the lead here. But what is interesting, on the other percentage that we see is 17%, you all asked for 13 other languages to be translated, that there was a need for translation services. So it just goes to show that there's a need for lots of languages to be translated from into, or excuse me, there's just a huge need for translation services in regards to our patient education. But in terms of what takes the lead, Spanish does here. Now we're getting into the aggregate data portion of the annual affiliate survey and its results. So in terms of total clients seen in 2021, from 193 active affiliates, 24,817 total clients were seen in 2021. What does that breakdown look like? Well, 85.8% were GDM, 12.4% of that 24,817 were type 2 diabetes, and 1.8% were type 1, represent type 1 diabetes. How does that compare to our years past? We've held the contract since 2014, so we have some data to look at in comparison to years past. So this range has been from around or just under 17,000 to this is the highest amount of clients seen and that has been reported to date, this 24,817 number. But we've had a bit of fluctuation over the last 8 or so years. The reason or the takeaway here is the total claims seen have still increased despite fluctuating affiliate site numbers. We also just saw a lot of consolidation of sites during the pandemic. So there was a lot of reorganization, and no matter how much these affiliate site numbers are, we still see this increase in total claims seen. In regards to percentage of type 1 diabetes over the years, we've seen it as low reported as 1.5% and as high as 1.8%, but it's remained the same the last 2 years at 1.8%. This is the most interesting takeaway or trend, in my opinion. We have never seen type 2 diabetes reported this high at 12.4% in 2021, and that has increased substantially since 2018. What about the percentage of GDM? We see just a slight downtick of numbers here in terms of the percentage. The lowest reported was in 2021 at 85.8%. Now let's look at our training modules. We have a total of 23 training module offerings posted on our website. Every training module has showed improved post-test scores, which is great. And participants represent both national and international presence. So our training modules are obviously a requirement for our affiliates within the state of California, but there are also non-affiliates that attend and participate because they're free to learn and watch. They're free to learn and watch from. So we see non-affiliates in the state of California, non-affiliates in the United States, in many other states. And then we also have an international presence. And particularly this last year, we had a lot of folks from Indonesia participate. What does this mean in terms of watch time? Well, we have over 2,000 hours of watch time, a lot of hits on YouTube in terms of views. And the attendees in total in the last fiscal year were 3,168. So we made 3,168 continuing education certificates as well. Here is a list of these training modules that we have posted. And like I mentioned before, starting with the CPSP, Medi-Cal Managed Care, Medi-Cal Fee-for-Service Payment Options, Billing Codes, and this Medical Insurers training module. These 5 were the ones we put out as they were a need expressed to us from our affiliates, and specifically not only in the training module survey, but just through emails and feedback from our annual affiliate survey. Many of you have asked us to put that out. So that took a lot of time and energy, but we finally got them out, and we hope you learn from them. Here is the list continued. In regards to our training module survey, we asked our affiliates, how would you rate the CDAPP training modules that you completed in terms of usefulness to your everyday practice? 1 being not useful or informative to daily practice, and a 5 being always useful and informative to daily practice. And the average rating was a 4.8, which is pretty great. Moving on to our materials and resources. If you have not noticed, we have revised 8 materials and resources in this last fiscal year. And I will show you screenshots in the coming slides of all of them. I do want to point out that the gestational diabetes, all you need to know about you and your baby, was still in revision. Here's information for pregnant individuals with gestational diabetes. This is a 2-page, slightly cut off because it could not fit on the screen, but it's a 2-page PDF handout that can be printed or emailed to your client. Here is a trifold setup, so printed and handed to your client, about gestational diabetes and how you and your baby can stay healthy. Here is another trifold, after pregnancy, lifestyle choices and diabetes. A nice My Meal Plan or chart for logging. This is also like the information on gestational diabetes handout. This is just a 2-page PDF about eating out wisely. Here is lastly a sample snacks 1-page that shares sample daytime and bedtime snacks. And last but definitely not least, we have the 2022 CDAPP Sweet Success Guidelines for Care that we have spent hours and days and years actually updating since the 2015 version. We have relied so heavily on our stakeholders and the writer group, and we're so grateful for the time and commitment towards this project, as this is a almost 300-page document and guideline. So this has been completed and has been turned down into MCAH, and please look for direction from them, email them about it, as it is in their hands. And just on behalf of Community Perinatal Network, I want to personally thank you and say we're grateful for your commitment to CDAPP Sweet Success and everything this program represents. You all work so hard, and we couldn't have revised all these resources or put out these training modules without you. So thank you so much for your commitment. And with that, I will end this training module.